Women asked me about the risk of C-section. And some of them are a little more serious than others, but ultimately, you're going to expect a longer recovery because you did have major abdominal surgery. And I do find that by about 2 weeks postpartum, most women who had a vaginal birth versus a C-section kind of feel about the same. But those first 2 weeks, you can have a little bit more pain, a little bit more difficulty moving, and you're likely going to be staying in the hospital for a little bit longer than if you had a vaginal birth. Most people after a vaginal birth can go home at 24 to 48 hours. After a C-section, it's usually about 2 to 4 days. You're also going to take longer to get back to doing the things that you want to do in life. And so exercise is going to take a little bit longer to get back to. Sex is probably going to be a little bit longer to get back to. And so when we're talking about C-sections and the risks involved, it's not just of the surgery itself, it's also of the upcoming, several weeks after the C-section that we have to think about. But when we think about surgical risks, with a C-section, there is a slight increased risk of bleeding, slight increased risk of infection. There's always risks with any sort of anesthesia you might get. And then there's a risk that we could accidentally injure your other organs. So the bladder's right there, the bowels are right there, and the uterus kind of pushes all those things away, but they can get in the way and get injured during surgery. Nobody is trying to do that, but that can happen. There's also, of course, a risk of pain during the procedure. We really try to keep your pain well controlled. In a C-section, you're numb from here down, but you're going to feel pressure sensation, tugging, pulling. You can feel nauseated. There are lots of sensations that you might feel during the procedure itself, but ultimately your pain should be manageable. And if not, then that might be one of the reasons that an anesthesiologist would actually put you to sleep. There are some increased risks to babies as well with C-sections. So with a vaginal birth, babies go through the birth canal and their little lungs get squeezed as they're going through. And that helps to push the fluid out of their lungs. Because if you think about the baby is in a fluid-filled environment, it's amniotic fluid while you're pregnant. And then when a baby's born, then they come into the air and they're required to use those lungs to breathe. So during a vaginal birth, the fluid helps get pushed out just by the birth process alone. But during a C-section, that process doesn't happen. And so babies can have a little bit more trouble breathing afterwards just because their lungs have more fluid in them that they need to work out on their own without that squeeze. There's also delayed bonding risks because, as I said, the baby's born and then typically evaluated from a pediatric standpoint before they get to come to you. And some places let you do skin to skin and some don't. But with vaginal births, pretty much everywhere these days is putting baby right on your belly after they're birthed, and you're doing immediate skin to skin contact. And so with a C-section, you can get a little bit of delayed bonding, which can sometimes also affect breastfeeding. And then there's this new theoretical risk of the microbiome being impacted. There's not enough data out there right now. I think they're doing studies to kind of see when a baby goes through the vagina, they're getting exposed to all kinds of good bacteria that helps populate their guts and therefore helps to prevent against things like asthma and allergies and things like that. But with a C-section, they're not going through the vagina, and so they're not getting that microbiome effect that they get with a vaginal birth.